which includes Tucson, is at full capacity. NBC's Steve Patterson is in Arizona with the latest.
Katie, the largest health system in the state says they'll be at 100% capacity here as early as next week, 125% just a few days after that. Yet the hospital I'm standing in front of is actually at 0% capacity. This is St. Luke's Hospital. It was shuttered in 2019, but it is currently being used as what's called a warm site, meaning something health officials can quickly spool up in the event that the crisis reaches such levels that there aren't any beds left in the state. This is a last resort option. It is essentially the nuclear option. If health officials decide to put it into play, it'll take about 7 to 14 days and then provide an additional 235 beds. But it does not solve the staffing crisis that is in this state. Health officials, doctors, nurses dealing with ratios that are absolutely untenable as waves of these COVID patients crash into ERs across the state. I spoke to a physician who's dealing with this on the ground level and is just fed up and frustrated with the fact that people are still ignoring the warnings this many months into the crisis. Here's what he said.
I had a colleague in the urgent care just the other day in her shift. She saw 36 patients, which is not unusual for an urgent care shift, but all 36 patients ended up testing positive for COVID-19. And of those 36, 4 of them were sent directly to the ICU. It's taxing mentally, emotionally. And when we go out and we see people still having a good time in restaurants and bars, people walking around without their masks on, it really is like a slap in the face. This is really not right. For the people who are on the front lines, who they're doing everything they can, they're sacrificing themselves and their families, and then we're seeing people just going outside minimizing this as if it's nothing serious.
Meanwhile, the heads of some of the largest health providers in the state held a meeting yesterday. They are demanding more from the state, from the governor. They want a statewide mask mandate. They want a ban on indoor dining. They want a curfew implemented. And they say they wouldn't be asking for these things now if they didn't absolutely need them. They need all options on the table, and that's their demand at this point. Katie?
You do not want to mess around with hospital capacity. It means that patient care is at risk. You don't want to go to a hospital, period, when they are that stressed out. And just think of all the other things that might happen to you, not getting COVID-19, other things that might send you to the hospital or one of your loved ones. Steve Patterson in Arizona. Stay dry, my friend. Thank you very much.